can you remove a lump after having filler on the face? Yeah, this patient is a patient who got in touch who said, I've got a lipoma from a filler. So I've got a filler and I've got a lipoma where the filler was. So obviously, so it's not a lipoma, that's filler. So that's why, so I asked Amy to put this on. So that is something that would need to be treated by the filler person, because that's a consequence of the filler. And this is one of the aspects, one of the things you've got to be a bit careful of when you have particularly filler, because filler is not a prescription medication. So anyone can get filler off the internet and then anyone can inject it. And the problem with filler is it can cause issues. And if you have got someone who's not trained and not able to deal with consequences, then you got a problem. Because if you have something like filler or have some kind of treatment, and then you go to someone else and look for help with the consequences or the complications of that treatment, you'll find that people are very reticent or not too keen to take you on, because it's the responsibility of the person who did the original procedure. And so that's why you've got to be careful if you have someone who's often not even a trained doctor, but certainly not trained surgeons, who are doing things like fillers, and they can be significant consequences from them. But the answer is you need to speak to the person who did the treatment. So if you have a lump after a filler to the face, often fillers are temporary, so they're often not permanent. So that's something. But you know, there are specific things you can use to dissolve them and what have you. So there are antidotes, if you like, to filler and what have you. So that's, but that would be, you know, to be dealt with from the practitioner, which is why you've got to be careful with the practitioner that you choose to have this sort of stuff, especially fillers. I mean, it's a nightmare, fillers, because as I say, anyone can buy them and inject them, and they can cause complications. They can cause serious complications. So don't take it lightly. Don't take the practitioner or a surgeon or doctor or whatever it is that's doing it. Do look at their qualifications, and you don't necessarily have to have a surgeon do it. You can, you know, but kind of well, I suppose you don't have to have a doctor. You may have a nurse. You kind of want someone trained in something. You want a trained person to do it, basically. Botox is a little bit different because it's a prescription drug, but even so, some people will get doctors to prescribe it, and then, you know, so you have to have a doctor or a prescriber to prescribe it, and then, but anyone can inject it. So it's a little bit more of a barrier to entry there, because it's a bit more difficult for the man in the street to get hold of Botox, but still not impossible. Whereas the man in the street can get hold of filler, and then yeah, you do get the man in the street injecting it, which could be difficult if you have a problem. And so yeah, we wouldn't help with a lump after having filler to the face. I don't do filler. I don't do Botox. I don't do any of that sort of non-surgical treatment. So as I say, you need to speak to your practitioner who kind of did it.